allegiance. I
pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Good morning. Welcome to the March 5th, 2018 meeting of the Shawnee County Board of County Commissioners. My name is Kevin Cook. I serve as the chair this year. Joining me today is Commissioner Bob Archer. Good morning.
Good morning.
And Commissioner Shelley Bueller. Good morning.
Good morning.
Madam Clerk, our first item.
First item is item 3, consent agenda.
We have 6 items on the consent agenda. Are there any questions regarding these items?
I'll move to approve the consent agenda as presented.
Second.
Motion made by Commissioner Archer for approval, seconded by Commissioner Bueller. All in favor, say aye. All opposed, passes 3-0. Our next item.
Item 4, new business. A, County Clerk. Number 1, consider all voucher payments.
Morning. The vouchers are totaling $738,821.17. We have holding accounts, $249,830.40. Health Insurance Administration, $238,873. And then finally, Workers' Comp with Thomas McGee at $65,000. I do not have any questions. I'll move approval.
Second.
Motion made by Commissioner Bueller for approval, seconded by Commissioner Archer. All in favor, say aye. All opposed, passes 3-0. Our next item.
Item A2, consider correction orders.
I'll move for approval.
Second.
Motion made by Commissioner Cook for approval, seconded by Commissioner Archer. All in favor, say aye. All opposed, passes 3-0. Our next item.
Item B, Bond Council. Number 1, consider approval of resolution number 2018-10, approving and authorizing the execution and delivery of a base lease agreement and lease purchase agreement in connection with the sale, issuance, and delivery of Shawnee County, Kansas Public Building Commission revenue bonds, Kansas Expo Center project, Series 2018, in principal amount not to exceed $32 million, and authorizing the officers, employees, and representatives of Shawnee County, Kansas to do and perform all things necessary, appropriate, and incidental thereto under the authority of KSA 12-1757 et sec.
Good morning, Bob Perry. In mid-January, you all passed a resolution requesting that the Kansas Public Building Commission, the PBC, issue its revenue bonds not to exceed $32 million. The purpose of the proceeds was to finance the Expo Center improvements. We had a conference call, a rating conference call last week, a week ago Friday, and they've reaffirmed the county's debt rating at AA1 for the bonds and AA2 for the COPS, and the PBC would also have an AA1 rating on those bonds. So that's an uptick that we received last October when we did a little refunding piece for the outstanding COPS that we have. This resolution would authorize the execution of a base lease and a lease agreement and ancillary documents with the PBC, under which we will lease the ground. PBC will lease from the county the site and the Expo facilities, we'll lease those back to the county under a lease purchase agreement. We'll use the rentals to pay off the PBC revenue bonds.
Bob, the county's bond rating under Moody's has gone up a couple of times over the last several years. Does this ultimately, when we do something like this, help the county save us money on the projects?
The upgrades basically will allow the long bonds to usually carry a little less interest cost. How much is totally dependent upon the market at the time that we enter it. But the long bonds, 10 years and thereafter, 8 years and thereafter, will have a little bit of a better interest cost. It might only be 5 basis points. It might be 10. It might be more, maybe less, depends on the market. But overall, we pay less interest cost. And when we started this process last November with the PBC, was again to reduce the interest cost paid and allow more principal to be, or more project funds to be used for the project.
Okay. Questions from Mr. Perry? Now, once we pass this resolution, if that is passed, what is the next step?
After this meeting, the Public Building Commission will meet, which are you three, and I'll ask you to pass a resolution authorizing the issue and sale and delivery of PBC revenue bonds not to exceed $32 million. The actual principal amount will be somewhat determined by when we get into the market, with the idea being to maximize as much proceeds in, but reduce as much interest that we have to pay over the 15-year term. And we've capped it at 32 based upon some numbers runs that Betty and the bankers have looked at. It may be less than 32. That would be dependent upon how big of the premium bonds that we get in.
And so when ultimately would we know about, and obviously we'll talk about this in the Public Building Codes, the PBC meeting later, but our time frame for knowing how much money we have or the amount of the rates?
Well, that'd be somewhat dependent upon when they decide to go to the market. Last Friday, we had a conference call with the bankers and Joe Crow, who's the head salesman for George K. Baum and Company. They were talking about maybe going into the market tomorrow. Late Friday afternoon, I was told that they're probably going to wait till midweek, the way the bond market ended last week. They kind of want to see how it shakes out at the beginning of this week before they get in. If it gets too volatile, they'll just step back.
So we may know as early as Thursday or by next Monday, a week from now, as to how that bond market has.
I think the plan, Kevin, is to get it done this week.
All right.
But unless it really moves away from us, then they'll probably get us back on a conference call, and Betty and I and the bankers have to make some sort of consensus of what we think would be a reasonable time to go.
Okay. Any other questions?
I'll move to adopt the resolution.
A second.
Motion to adopt the resolution by Commissioner Archer, seconded by Commissioner Bueller. All in favor, say aye. All opposed, passes 3-0.
Thank
you
you.
very much. Our next item.
Item C, Emergency Management. Number 1, consider approval of Ambulance Compliance Officer Year-End Report 2017.
Morning, Commissioners. Nelson Castile, Ambulance Compliance. I will find my mouse here. In March of 2015, that'd be 3 years ago, this body directed myself and Betty Greiner, Director of Administrative Services, to have the Ambulance Advisory Board create an RFP for ambulance services. The prior contract was from 2006 to 2016. In March of 2016, an RFP was issued in January. We received bids for that. The evaluation committee went through, they presented it to you, and we negotiated then the contract that went into effect on January 1st of 2017. This is the first full year of that contract. We have reaped quite a few benefits from it. I believe it's here. Just kind of what we got here was the fractal response times. We've got free training for responders. There was less of those exemption options, which eliminated the system overload. The equipment exchange and the buying power, and AMR dispatchers being in the 911 center. We also went from 2012, where I believe we paid $1,078,000 to AMR as a subsidy in the years all previous to that, and then we started cutting that back this year and for the next 5 years, and then possibly 7 years, depending on the extensions. We are giving AMR a subsidy of $300,000. The subsidy pays for those folks that can't pay. It's more of a social grant program. It takes care of that. And then they receive an additional $50,000 for having their dispatchers in the 911 center. For the $350,000 that we have provided, we have seen outstanding results. And that's kind of what this report goes into. I did send you the report. It's several pages long, and it goes down each of the requirements that I look at. I have seen no problems with compliance with AMR. Is there any questions?
Nelson, I noticed in the report, it looked like just in the compliance, it's really outstanding with how we had a total of 21,271 emergency calls in 2017. And that is really just a large amount of calls, and the response times and compliance is really just outstanding for that amount of calls.
Yeah, that number is actually all calls, emergency and non-emergency. That was one of the other benefits of the contract we had. And you can see that they've had some significant penalties, but when you look at the number of penalties they had, 433 times that they were penalized monetarily out of that 21,271 is outstanding. AMR is required to be at 80% or higher, and so far, including the month we just went through of January, where you're going to see an even bigger number come out of this, they have always maintained 90% or higher. And also looking at the very bottom line, most of the exemptions that we have seen, those are ones where we take the call out of the mix because of an issue, whether it's weather or something they can't control. The big percentage of those are weather and staged calls. And on the staged calls, it is part of a new paradigm nationwide that if you do not need to run with lights and sirens at certain periods, you do not do so. We factored that into the contract, which gave me the leeway to look at each of those calls and say, yes, they made it, or no, they did not make it. It solves the problem of an ambulance running lights and sirens to a call that they then sit there 15 minutes waiting on the scene to be secure. And that puts a lot of targets on those ambulances out there for people that are doing those other things you're not supposed to be doing in a car normally. They're not paying attention. And so I'm very happy with the 40 that we came out with, even with the weather. January's a little bit higher because we had some of that nice winter weather that was there. So the 13,281 goes into that grant fund for the first responders, and they did not use it last year. It's a special revenue fund, and you approved the process, I believe, last April in how to disperse that.
Questions for Nelson?
I don't know that I have questions, but I know John AMR is here today, and
Yeah.
I would just say thank you, and the performance has been much improved, I believe, and I know we're responsible for the contract and the compliance, but then we work with others on the Ambulance Advisory Committee, with Topeka Fire, with the rural fire districts, with the hospital representatives and the Sheriff's Department. So, and I guess on that note, I wanted to ask you, the next 18 months, you listed some things you're going to be working on. Can you go into that a little bit?
Yes, ma'am. The part of what I mentioned in one of the bullet points there was the 911 dispatchers and that integration, due to some making sure that we have documentation, making sure that we are doing things correctly. We are still working on the integration between AMR and the county. The CAD-to-CAD interface will likely solve about 98% of our problems, but that is a computer issue that is way above my head. The other thing is, my office will likely put in for what is called the Pro QA, which is a quality assurance for the fire and ambulance side of things, which is where they go down and ask the questions, they EMD the call. It's triaging it, other than just saying, hey, I'm bleeding, send me help. It goes down and figures out, why are you bleeding, or why, what kind of response do you get, especially in those days that we have a lot of calls. Currently, we have a working group that will be meeting hopefully this week of all the medical officers from each department. That would be Shawnee County Fire District 1, 2, 3, and 4, Mission, Soldier, Topeka Fire, the 190th, and MTAA, as well as any of our other first response agencies, such as some of our law enforcement, to look at the protocols and rewrite them so that we can match them up with what some of the new standards are. And then the community paramedicine is something that gets mentioned. I get a newsletter every day from the EMS folks nationwide, and there's always an article in there about it. There are so many different hybrids, there are so many different items out there in the manner of which we can do it. And so we are hoping to bring in the folks from our Department of Corrections, the police department, the hospitals, and then also work with some of those folks that have the ear of our legislatures on this, can care and the Medicaid and stuff like that, so that we're not just surging ERs on a constant basis. And that's a big point of the community paramedicine. There's a lot of moving parts there.
There is. Is that, Nelson, is that kind of part of is that the advanced life support? Is that part of the community paramedicine or?
It could be. Advanced life support means that there is a paramedic on the unit.
On a fire unit versus?
On a fire unit or on an AMR unit. We require a paramedic and an EMT at the minimum by contract. I don't know I have not talked to fire and gotten a definitive answer about what theirs is going to look like. When we say community paramedicine, that's why I say it's kind of one of those favorite words that everybody can throw out, and you kind of have one idea what it is. The paramedicine could involve nurse practitioners, social workers, law enforcement, some of those professionals that can help some of our populations that we may not be helping as much right now.
And I think it's just important to note that, because I think it's looking at keeping costs down, bringing costs down, and so I think we're just going to hear more about that.
Yes, ma'am.
That's my guess.
Yes, ma'am.
Thanks.
Commissioner Archer, anything?
No.
John, I do want to, if there's anything you want to say, but also to thank you for your leadership. It's been much appreciated. We're glad that AMR was able to attract you to come to our community and implement some of those changes that you've made just as boots on the ground with AMR.
Right. So it definitely was a very stressful year. Obviously, a new contract. The communication piece was a huge piece, bringing everybody back here so we can have that improved communications. Like I said, there's still some pieces missing. That CAD-to-CAD interface is going to be the most important. So if CECC enters information, we get it. If we enter information, they get it immediately. So we're working diligently. The transition's been difficult, challenging, but in the same time, it's been very easy with the collaboration with all the first responders and Nelson's office and everything. But it definitely, I sound like a broken record, but every year it gets higher and higher and higher. And like Nelson was saying, this year, January has been very, very busy for us. We're starting to see a little downward trend now that the flu season, hopefully, is over for us. But it has been very busy for us. But we definitely appreciate the opportunity to be here. We'll continue to work hard to make sure that we strive to get these numbers or potentially even improve them.
All right. Thank you.
Right. Thank you.
Is there a motion to approve?
So moved.
Second? I'll second. So motion to approve by Commissioner Bueller, seconded by Commissioner Cook. All in favor, say aye. All opposed, passes 3-0. Our next item.
Thank you, Commissioner.
Thank you, Nelson.
Item C2, consider approval of request to award bid for hazardous materials training to federal resources and authorization and execution of contract C77-2018 for same at a cost of $27,750 with funding from the Hazardous Materials Emergency Preparedness Grant.
Good morning, Commissioners. Aaron Mahan with Shawnee County Emergency Management. I'm currently the Training and Exercise Coordinator. Last year, late 2017, Shawnee County was awarded a Hazardous Materials Emergency Preparedness Grant in the amount of approximately $102,000, which was approved and signed and returned to the state in November of last year. We are putting together several different courses, and the first course we would like to offer is what's called Hazmat IQ class, which is designed and is a sole source provider through federal resources. The amount of the class is $27,750, and we request to use that amount of those grant funds in order to produce this class and offer it here in Shawnee County for local and rural emergency responders in hazardous materials emergency decontamination.
Any questions on this item?
I'll move approval of the contract.
Motion for approval by Commissioner Bueller,
Second.
second by Commissioner Archer. All in favor, say aye. All opposed, passes 3-0.
Thank you.
Thank you. Our next item.
Item D, Parks and Recreation. Number 1, consider approval of request to award bid for maintenance and painting of pools at Oakland and Bladesdell pool sites to J.F. McGivern, Inc., and authorization and execution of contract C-78-2018 for same at a cost of $31,805 for Oakland Pool and $78,855 for Bladesdell, with funding from the Capital Maintenance 3R Fund Aquatics.
Good morning, County Commissioners. David Alaker, Shawnee County Parks and Rec. This gone out for RFP. This is the results of these two pools. If you have any questions, I'll be glad to answer them.
Well, it's that time of the year to get everything ready for
Yes.
summer.
Yes. It's coming up quick.
Any questions about the painting of these two pools?
I'll move to approve the contract.
Second.
Motion to approve by Commissioner Archer, second by Commissioner Bueller. All in favor, say aye. All opposed, passes 3-0. Our next item.
D2, consider approval of request to award bids for the purchase of chemicals for the operation of the noxious weeds and Parks and Recreation Departments for the remainder of the 2018 calendar year, with an option for a one-year renewal.
It's me again. You're stuck with me again. We ended up doing, everybody within the county doing for bids on chemicals, and we went out for RFP, and these ones that are come to you will be the ones that got awarded the bids. I'll try to answer. I know pool side, I don't know too much on noxious weed side, but I can make it up.
We've got, I see John Wellborn at the back of the room if you have any questions regarding our noxious weed chemicals, but any questions regarding the awarding the bids for the purchase of chemicals?
I would just ask, is there anything that's out of the ordinary that we didn't have last year, or?
Pool chemicals, no.
No.
Basically standard
Noxious weed
ProQuo.
department.
I'm guessing,
I see.
John says we're good on that end too, so.
Okay, all right.
I'll move approval of the request to award the bids.
Second.
Motion made by Commissioner Cook, seconded by Commissioner Bueller. All in favor, say aye. All opposed, passes 3-0. Our next item.
Item D3, consider authorization and execution of contract C-79-2018 with Jim Richards for an agricultural lease agreement to farm 7.44 acres of ground in a portion of Dornwood Park for a lease period of 1 year, with the option to renew the lease for a total period of two one-year terms, in which he will contribute $558 annually to the Shawnee County Parks and Recreation Foundation for the support of the Friends of Dornwood.
Good morning, Commissioners. Rachel Meyer, Shawnee County Parks and Recreation. This is a renewal on a lease of ag property, and this will continue to renew until we do make a change. We are communicating with the landowner, possibly of exchanging property to make a right-of-way for the trail of Deer Creek. So we have been working with him on that, and when we move further with that process, we'll come to you and talk a little bit further.
Any questions regarding this extension of the prior agreement?
I'll move to approve.
A second.
Motion made by Commissioner Archer, seconded by Commissioner Bueller. All in favor, say aye. All opposed, passes 3-0. Our next item.
Item D4, consider approval of request to award bid for pool maintenance and painting of the Shawnee County North Pool to utility maintenance contractors, and authorization and execution of contract C-80-2018 for same at a total cost of $80,743, with funding from the Capital Maintenance 3R Fund Aquatics.
Morning, County Commissioners. You get lucky you have me again. This is part of the same process as what before. This is just a different company. The North Pool will be done in the fall of 2019.
Questions regarding this contract?
I don't have any questions on the contract, but while we have you up here still, how are we looking for lifeguards? And if you're interested in
Yes.
being a lifeguard, what do you do to become a lifeguard?
Okay, applications are online, so they can go online and submit. I try to do interviews during spring break, which that's in a couple of weeks.
Yep.
And we go until we're full, and I will keep continuing to take them. Luckily, I have quite a few people coming back this year, so that's awesome, but I still have openings.
And so if you were employed last year, do you still have to fill out an application?
No, we deactivate them, so your daughter doesn't have to apply again this year. We make the process easier. What I do in the off season is I deactivate them, and then when they come in, during spring break, I'll send out a text to all my staff, because teenagers have a tendency to reply to text versus
They do.
phone calls.
They do.
They will come in, a lot of them will come in during spring break, do a lot of activation paperwork, and we'll be ready to go by opening day.
Okay.
David, how many lifeguards do we employ just within a season?
With concessions and lifeguards, I have roughly 200 employees that I supervise.
It's a good summer job.
Yeah.
Great summer job. Yeah. So, okay, well,
All right?
I don't know if I made a motion. I'll make a motion to approve.
Second.
Motion to approve by Commissioner Bueller, seconded by Commissioner Archer. All in favor, say aye. All opposed, passes 3-0. And make sure you fill out those applications for being a lifeguard. Our next item.
Definitely.
Item E, Kansas Expo Center, number 1, consider approval of request for capital expenditures in a total amount of $12,527.10 as follows. A, land and arena boiler repairs by PCI for parts and services totaling $10,375.13. And B, south parking lot driveway repair by Shawnee County Department of Public Works in an amount of $2,151.97.
Good morning, Commissioners. Kellen Seitz, Inspector of Venue Management, Kansas Expo Center. If you recall, we've talked in the past about some of the deferred maintenance and capital expenditure repair that we've done at the facility in regards to the boiler repair and failure that took place in mid-November, as well as driveline repair in the entry drive on the, get my direction straight here, on the southernmost side nearest 21st Street. And Tom Black and his team came out and repaired that drive for us, and PCI came out and repaired the boiler for us as well. Both of these requests for capital expenditures have been presented and approved by the Kansas Expo Center Advisory Board, and just wish that you give us the approval for that as well.
Questions regarding these capital expenditures?
I'll move to approve the request.
Second.
Motion for approval by Commissioner Archer, seconded by Commissioner Bueller. All in favor, say aye. All opposed, passes 3-0.
Thank you.
Our next item.
Item F, Health Department, number 1, consider approval of request to fill the clinical services team leader position at a range 17, step 5, for a candidate with 10 years of experience at an annual salary including benefits of $80,425.20.
Good morning, Commissioners. Linda Oakes from the Health Department. We were very fortunate to get this candidate to apply for our clinical services team leader. She did work with the Shawnee County Health Agency for 10 years, 5 of those years in management. She's worked with the Vaccines for Children program. She's worked in women's health, so I feel like we're getting a really qualified candidate here, so I'm asking to start her at a step 5. I did discuss this with Angela Lewis with HR, and she's in agreement, and we do have the funds to cover it in our budget due to other people shifting into positions. And I'd be happy to answer any questions.
Any questions regarding this request?
No, move approval.
I'll second. So motion for approval by Commissioner Bueller, seconded by Commissioner Cook. All in favor, say aye. All opposed, passes 3-0. Our next item.
Item F2, consider approval of request to reclassify and fill a vacant registered nurse position and any subsequent positions that become vacant from filling this position at a salary including benefits of $65,582, and to reclassify 3 filled RN positions in the Nurse Family Practitioner Program due to the revised position description only. Range, step, and wage remain the same.
Good morning, Commissioners. Teresa Fisher with the Health Department. Before you today is a request to reclassify and fill a vacant registered nurse position in our Nurse Family Partnership Program, and to also reclassify 3 filled positions in the Nurse Family Partnership Program. The request for the reclassification is specific to the position description only. We reviewed that for accuracy of duties since becoming an official Nurse Family Partnership Program, and felt that it needed to be updated to reflect that program and some of the required components for it. It doesn't affect their wage, their step, or their range at all on that. The position we're asking to fill today is funded entirely by the Early Childhood Block Grant, which we're recipients of. And with that, I'd like to take just a couple of minutes and share a little bit about the Nurse Family Partnership Program and early childhood education and why this is important to our community. So, This quote here is from the founder of Nurse Family Partnership Program, and what he found is that this is a program that's preventative, and we'll see in another slide the impacts that it can have on the mothers and babies and what it has been shown to have. And he really developed this concept of this magic window. So in the Nurse Family Partnership Program, we enroll mothers during their pregnancy, and during this window of opportunity, we found that there's really a time where they're eager to learn, they're motivated to become better parents, and hopefully overcome some of these obstacles they faced. This is what we've learned from research so far. We've learned that during the child's first 3 years, a lot happens during that time. There's a lot going on in Shawnee County right now with Momentum 2022 and the kindergarten readiness. And so this, to me, is a part of kindergarten readiness. We have to start during the pregnancy, and we have to build on that during these first 3 years before they ever get to childhood, or to preschool, excuse me. That's the important part that we need to make sure is being assessed as we look at kindergarten readiness. This is some of the outcomes that this particular program has had. As I mentioned, it has been shown to make an impact on the lives of these children and their families. So I just pulled out a few select numbers here. So improving pregnancy outcomes, it saw a huge reduction in preterm deliveries. Improving child health and development, we saw an increase in the children's school readiness, both in language delays and their reduction in intellectual problems. There's a reduction in child arrest, and this program also works to improve the economic self-sufficiency of the families. And this saw a reduction in both in welfare use and an increase in maternal employment. So being able to fill this particular position that I'm asking to fill today opens up 25 additional slots for families here in Shawnee County that we hope would be able to see some of these impacts. And then again, this is just about the return. We know it has a lot of impacts. That ultimately, it helps to raise the quality of the workforce that we'll have here in Shawnee County and hopefully enhance the productivity of our schools. I feel strongly that early childhood programs, again, is really where we need to focus our efforts to hopefully make an impact on society. I'd be happy to answer any questions.
Any questions regarding this request?
No questions, good presentation.
Absolutely.
Very good. I'll move approval.
I'll second. Motion for approval by Commissioner Bueller, second by Commissioner Cook. All in favor say aye. All opposed? Passes 3-0.
Thank you.
Thanks. Our next item.
Item F3, consider approval of request to create and fill an epidemiologist position in the Shawnee, that's what she said, and the Shawnee County Health Department, and any subsequent positions which result from filling this position at a salary including benefits of $61,214.
Good morning, Commissioners. Linda Oaks from the Health Department again. So I wanted to take just a few minutes to talk about epidemiology and what it is. And so why do we need an epidemiologist here at Shawnee County? So the word epidemiology comes from the Greek word epidemic, and it means epi is upon, demos is people, and ology is science or study. So it is the science or study which deals with what falls upon people. And so I can't talk about epidemiology without talking about Jon Snow. And I don't mean Jon Snow, the 998th Lord Commander of the Night's Watch in the Game of Thrones. I mean Jon Snow, the father of modern epidemiology. So Jon Snow was the person who worked to track the source of a cholera outbreak in London in 1854. And he was able to map the cases and trace the source of the disease to the Broadway pump. He convinced the Board of Guardians of the St. James Parish to remove the pump handle, and he ended the epidemic. 578 people died in that epidemic. And so this is his map, and you can see the little black, those are the deaths that he traced, and the pump is right there. So I'm trying to get it. I guess I'll have to do the screen. Yes, so that's the pump that he took the handle off. And some people, you can see there were some pretty far away. Some people walked a long way to that pump because they thought the water tasted better. So it's a sad situation. So there's a great book, if you'd like some good reading, called The Ghost Map, that talks about this whole epidemic and Jon Snow, and I highly recommend it. So the definition of epidemiology is the study of the distribution and determinants of health-related states or events in specified populations and the application of the study to the control of health problems. So we have all that. So what does an epidemiologist do? So the first thing epidemiologists do is they rapidly recognize and respond effectively to disease outbreaks. We've been very fortunate in Shawnee County. We haven't had a lot of big outbreaks. We could. And so this person will be very helpful if we do have an outbreak to help us trace the source more quickly and hopefully stop the epidemic more quickly. Just to give you an example of what those outbreaks can cost, in Utah County, Utah, they had 3 cases of measles from the Disney. 3 cases of actual measles. They ended up spending $115,000 in direct costs for that investigation. They made 1,600 phone calls to contacts and administered 600 vaccinations. And they normally give about 100 MMR vaccines per month, and we give about 80. So it's a much more populous area, but you can see the impact of an outbreak to a community. The second thing they do is data visualization and publications. I do have some examples to show you here coming up of some of the things that epidemiologists have done in other counties around us. And then data analysis. And this is the part really I'm probably the most excited about, because they can help us with the community health needs assessment. They can help us with grant applications, program analysis, activities. Momentum 2022 is looking at health metrics right now. They can help with those efforts. The county health rankings are going to be released in a week and a half, March 14th. They can help us with those efforts that we're doing to improve the health of our county. So I see this position as not just for the health department, but for the entire community. So this is an example from Douglas County. They looked at life expectancy. And so they took the average of their life expectancy, and the blue are people who live longer than the average, and the red area are people that don't live as long, that live in that area. So I know we've talked about sometimes your health and your life depends on your zip code. So this is an example of what their epidemiologists produced to show that, that cause. So I thought it would be interesting to show a little infographic about sitting disease, because we talked about active meetings last week. And so some epidemiologists have done some studies about this. And one of the studies in Vanderbilt said Americans spend 55% of their waking time in sedentary behaviors. And during another study period, they showed women who were inactive and sat over 6 hours a day were 94% more likely to die during the period study than those who were physically active and sat less than 3 hours per day. So we have a lot of good information about this sitting. I'm looking forward to that active meeting policy to come forward. So my question is, are we making an impact, or are we just howling at the moon? And I'm sure we've all done a lot of that, but we hope that this person will help us show the outcome of what we're doing. And I do have one other example. If I can get out of here. Well, maybe here we go. Here it goes. This is from Douglas County. And let's see. So this information sheet, they've published quite a few of these, and I think they're very interesting. This one is about adult smoking, and I've been up here and talked about adult smoking multiple times, so I thought it was a good example. So they showed in 2013, 15% of their adults in Douglas County were current smokers. And then I like this graphic here. They show the trend line going down. So they've got that. They divide it by gender, age, education, annual household income. They had some findings that people that had high school or less were more likely to smoke than those with college, and the percent of smokers decreased as annual income increased. And so they have some additional information. So these kind of reports can be really helpful, I think, to us as we're looking at improving the health of Shawnee County. So this position would come in, the annual salary is $61,214. We do have it covered in our 2018 budget, and I'd be happy to answer any questions about epidemiologists or about this position.
Linda, this is a new position that we're creating, and Shawnee County has not had one before.
Years ago, we had one. It's been a long time, though.
Okay.
Yes.
And if we move forward with this position, outside of, tracking our data and looking at the health rankings and really identifying where our needs are, what are some of the advantages that we might have by this position?
I think the advantages that we might have, I look especially, for instance, the county health needs assessment. We need to do a very robust needs assessment next time. And so that's what I'm looking forward to, is looking at not only what do we see that needs to be improved, but what do the people that are actually in the community, what do they want to work on? What are their goals? So I see that person doing that. I think another advantage, again, is outbreaks. I mean, we could easily have outbreaks, and so to help us try to stop those outbreaks before they get so big and so costly in health, lives, and financially. So I think most health departments our size do have an epidemiologist on staff, at least one, if not more than one. And honestly, I probably could keep two busy, but I'll start with one, if you will allow that.
Questions for Linda regarding
Well,
Commissioner?
Yeah, the focus would be on an outbreak and everything. While we're waiting for an outbreak, what would this position be doing in the meantime?
So program analysis, they'll be helping again with those community efforts, such as Heartland Healthy Neighborhoods, working on the Community Health Improvement Plan, helping us find those. So we have a needs assessment, and we say, yes, we need to work on mental health. So they will help us form those interventions, and then they'll help us analyze those interventions. So yes, we're doing this, and it's making an improvement this much. And so this kind of like a smoking report. We're targeting maybe certain parts of Topeka to help adults quit smoking. They can help us show that improvement, and then help us say, well, wait, this program didn't work, so let's shift. So I do see that value, too, is that we can make sure we're on the right track, and they will help us with that.
I think it's important. Anytime we add a new position to Shawnee County, we justify it.
Sure.
And in my discussions with you, what I was encouraged by was your thoughts that it would improve our health rankings. And I think that's a concern for all of the commissioners in the community. And so I'm going to support this, and I'll move to approve.
Motion to approve by Commissioner Archer. Commissioner Bueller, do you have any questions?
I'll see if there's a second.
There's a
first.
second.
Okay. This is a gap that's been identified for a long time, and so I am completely going to support this. This work has been being done by a number of different coalitions, a number of different volunteers. This will bring it up a level,
Yes.
definitely, and it will give the attention that is needed. So I completely support this. Thank you, Linda, and thank you to your team.
Thank you.
For getting this together. Appreciate it.
Motion made by Commissioner Archer, seconded by Commissioner Cook. All in favor, say aye. All opposed, passes 3-0.
Thank you, Commissioners.
Our next item.
Item G, Administrative Services, number 1, consider approval of request to purchase furniture for the Register of Deeds office in the amount of $12,767.98 paid from the department's budget.
Betty Greiner, Director of Administrative Services. Towards the end of last year, the Register of Deeds asked my office about a purchase of furniture that they were going to make, and asked if it needed to be have approval from the BCC, and at that time, based on the purchase of the price of the purchase was under $10,000, and we told them no, that was not necessary, and it's also under state contract pricing. What we failed to include was the tear-down costs, the installation costs, which do need to be considered as part of that project. And that, of course, took it over the $10,000. So what I am asking is for your approval for this purchase. It has already been purchased, but has not been paid for yet. So I'm asking for your approval. The total is $12,767.98. That will be paid out of the 17 budget and the 18 budget. $1,120 of that will be paid out of the 18 budget for the installation charges.
Questions regarding this? I'll move approval.
Second.
Motion for approval by Commissioner Cook, second by Commissioner Archer. All in favor, say aye. All opposed, passes 3-0. Thank you. Our next item.
Item H, Commission number 1, consider approval of Resolution 2018-11, amending Resolution 2014-110, reorganizing the reporting structure of Shawnee County departments.
Commissioners, this is a resolution that we're bringing forward. This is something that we've been working on. trying to look at our number of contacts and direct reports to the commission, Shawnee County holds the distinction in Kansas of being the largest county without a county manager. And so, in the absence of a county manager, the Board of County Commissioners really do operate as that daily contact, and we rely very heavily on our department heads, but sometimes making sure that we have more contacts and more abilities to network and get people out of our silos and really collaborate with each other. And this is one more step towards that. And by all means, the appraiser would still have the ability to contact the commissioners directly regarding an agenda item or a concern that they may have, but really working with the counselor's office in that structure. Questions regarding the resolution? I'll move approval.
Second.
Motion for approval by Commissioner Cook, seconded by Commissioner Archer. All in favor, say aye. All opposed? Passes 3-0. Thank you very much. Our next item.
Item 5, Administrative Communications.
This is an opportunity for any member of the public or department head to address the commission on an item of interest or importance.
Good morning, Commissioners. Dusty Nichols, Emergency Management. I just wanted to remind everybody, this week is Severe Weather Awareness Week, and tomorrow is the statewide tornado drill at 10 a.m. 10 a.m. is the tornado drill. Weather is okay. We're sounding sirens at 10 a.m., so just to make sure that's good to go. Also, we have the Severe Weather talk tonight at Washburn University. We partner with them and the National Weather Service and Washburn University, of course, to provide that. So it starts, doors open at 6, the show starts at 7. So,
right.
Any questions?
Thank you very much.
10 a.m.
10 a.m.
tomorrow.
Got it.
Carol Marple. I just had a couple of questions. With the county appraiser reporting to the county attorney, will that be a pay increase for the county attorney?
No, the county counselor is not receiving any increase.
Wrong title. Okay. Well, I know that sometimes when you added other county offices reporting to a specific person, there were pay increases. So I just wanted to know. And then my other curiosity question is, and maybe you'll talk about this in the public meeting, is your bonding $32 million for the expo? How are we going to pay for the rest of the $45 million, the difference?
That'll be in our PBC meeting in just a couple minutes. We're going to be talking about that item. So,
and you'll explain where the extra money comes, the additional money?
Stay tuned.
Stay tuned.
I will stay. Thank you.
Any other administrative communications this morning? All right, Quentin, this is the one we've been waiting on.
Best for last. How we doing, Commissioners? My name is Quentin Unruh with the Shawnee County Preparedness. I'm an EPCO specialist, emergency preparedness, community outreach. And emphasize that again tomorrow at 10 o'clock, tornado drills. All right. And Dusty, I think you broke this. Does anybody see the mouse on here?
Probably put the batteries in backwards.
I was multitasking.
That's emergency management. The suspense intensifies.
I apologize. That's got to do it. Come on.
Not yet.
Darn it.
All right. I might have to improv, I guess. Is there any way you can select them on the keyboard?
Mark.
Hey, Mark. Sorry about that.
Keep calm, IT is here.
Is it on the desktop?
That's the Project Topeka one.
And plug it back in, that's what's usually going around.
We just take that Etch-a-Sketch and shake it upside down.
There we go. There it is. Yep. All right. Thank you, Mark.
Should does that work?
Yep. Okay. So it's not PowerPoint. That's okay. Can you select it down to the PowerPoint thing?
The shortcut key to do that.
Right.
If you want to start off,
I'll
you
just
can.
start. Okay. Again, hello. My name is Quentin. Where were we? So I work in emergency preparedness at the health department. I also, as other dues assigned, got the pleasure to help with our Project Topeka food sculpture campaign this year. We had a really good competition, a lot of good sculptures this year. It's the second year I've done it. So I'm going to go through this, and we're going to announce the winner. And I bet somebody's really looking forward to seeing that. A lot of people have been trying to get that out of me all week. So here we go. So our first one, this one was done by Women, Infants, and Children program at the health department. This is Thomas the Chain. I'm sure many of you might know this. Choo Choo Choose to End Hunger. It was a pretty cool sculpture. The one that had the most cans, really detailed. So, and again, we had our judging panel consisted of Commissioner Cook, and we had some guests from KSNT and WIVW both help us as well. This is also at the health department. This is the Great Overland Station, kind of a landmark here in Topeka. That train actually was moving at the time and choo-chooing and that type of thing. And every flag is on there. The detail's amazing. This was at dispatch. The one thing I really liked about this is the symbolic nature of it. The ribbon in the middle was basically 911 emergency, which held everybody together, which I thought was pretty cool. The detail there in like the fire truck and the AMS and the police car at the bottom was pretty neat too. This was here. I'm sure some of these were apprised of this a little bit sooner than everybody else got to see it. So this was the American flag here at the courthouse. Actually, I'm sorry, Human Resources did this one. And this is all aboard from Parks and Recreation. At the top, I'm sorry if I didn't show you, but this is the cans and the beans and the tuna that were consisted of each one of these sculptures. So the winner is all aboard. Congratulations. We actually invited Stacy Warren for this. Yeah, so there's really good competition. I'm not sure what the thing was, the train theme this year, but congratulations. You want to get a photo?
Stacy did all the work. I'll let her take all the credit.
So good job.
Congratulations.
Again, it was fun. I appreciate the opportunity. Thank you. Look forward to next year.
Yeah, and next year, let's have some more departments and increase this competition.
Absolutely, absolutely.
Good to have and for a good project, too. Any other administrative communications? Commissioner Archer, do you have anything?
No, nothing today. Thank you.
I do not.
I do not either, so we are on to our next item.
Item 6, executive session.
There is not a need for an executive session, so we are adjourned from the meeting of the Board of County Commissioners and moving into our meeting of the Shawnee County, Kansas Public Building Commission. So at this time, I think our proper protocol is to open And we would do that by motion.